and it is on memory loss. Common expression, याद नहीं रहता, याददाश्त खत्म हो रही है. This is a sort of thing we'll be talking about. Loss of memory, word dementia, Alzheimer, all these things will be talked about. But before we do that, I just want to recognize one family, and that's the Lal family. Shorty Lal is sitting here. And all of you know the tragedy that we had in this family. So, Kishori's wife has this disease that we're going to talk. A dear friend, most of you know her, and big devotee of this temple. So the Lal family, a number of years back, they gave a large donation to the Alzheimer Society, and this is the endowment fund, and that's in Saroj's name. The purpose of this endowment fund is to invite lecturers, speakers, experts every year, annual lectureship, and give lecture on research, prevention, treatment of Alzheimer's disease. So that is what it is. And today we also have Saroj's brother, Vijay, is sitting here. He came from India. And so on your behalf, and I'd like to thank the family for organizing, coordinating this lecture, today's lecture. And so Jamie will be talking to us on the topic. Before Jamie takes over, I want to introduce this subject. You may be familiar with it. Spend a few moments to understand what is vascular health. Okay. Can I have control?
Yes.
What is vascular health? Now, if you understand vascular health, you have the answer to many of our chronic diseases. What is vascular health? Simple. Health of the blood vessel. Now you ask the second question, what is blood vessel? This is the blood vessel. On your right, there is a pointer too. Pointer?
I've never used it. You can try it.
Oh. This is the blood vessel, and that's the cell. Cell is the life. Everything that we suffer, disease or whatever, it is because the cell is not working the way it should. Whether it's the brain cell, whether it's the heart cell, it's the lung cell, kidney cell, any cell for that matter. That's the life. And it is maintained in proper order, but by what we do in the blood vessel. Blood vessels, as you know, are the tiny structures and supply blood to every part of the body. And it always ends at the cell level. So the blood vessel, the pressure inside, the cholesterol inside, the smoking, the toxins, diabetes, sugar, you name it. It is in the blood vessel, there is no other place. Because you go for a blood test and that's what you do. So that thing supplies the cell and can change the function of the cell in the right way or the wrong way. So that is the vascular health that I'm talking about, its implications, how the disease starts. In anybody, no matter what disease it is, Let's look at it. Chronic disease, which we have in the society, this is a common problem. Which is the most common disease, chronic disease that we have in the society? Can anybody guess? Name it. Heart.
Blood pressure,
Blood pressure.
diabetes.
Cardiovascular disease. Heart. And stroke is number one. 35 out of 100 people every year die of heart and stroke. What is it? It's a blood vessel. What is number two?
Diabetes.
Number two is cancer. Now, what is the relationship of cancer to blood vessel? Amazing. Lot of correlation with the blood vessel also. What is number three? Chronic disease. Lungs. Pulmonary disease. Chronic bronchitis, asthma, all related problems is number three. What's number four is what we are going to talk today. Mental health. And loss of memory, Alzheimer, all come into this category. You read in the newspaper, and we are going to hear directly from Jamie how this dementia or memory loss is on the rise. So what is the common relationship? What is the relationship to the vascular health? All of these. Let's look at the cause. How these things start and what makes it happen. Who is at risk to develop all of these diseases or any disease for that matter? When I say number one, non-modifiable, that means we can't do anything about it, we just have to accept it. Although more research coming up that there can be some changes even in this category of non-modifiable. For example, can you change the genes? No. There are experiments going on. You must know genes at least this way, if not in detail. Genes are like the computer, the hard disk, the chip. It's there, everything is stored there. So you manufacture, that's the hard disk. In human genes, we inherit genes from our parents. So that's like a hard disk. Now, the computer, something goes wrong because of the virus. That's from outside. Similarly, genes can be affected by what we do in life. Now, that point, very few people talk about it, and that's called epigenetics. Outside the usual thing that we talk about. Next is gender. You can't change gender, but at the same time, there are certain changes related to gender. Some males are more prone to certain, females are also likewise. Ethnicity. We talk about the South Asians in these seminars for the last 18 months. Age. I think this is what I want to spend a moment on it. You must understand what has happened in the last 60, 70 years. It's amazing. 65 years ago, 1949, what was the median age in Canada? Today is 40. At that time it was 27. What was the lifespan? How long did we live? About 65. There is a point here. Median age in 1949 is 27. Your lifespan is 65. Today, median age is 40, and our survival is 80. That 20 years that we got extra, that's where all the chronic diseases come. So there is a relevance here. We have 20 extra years to develop chronic disease, which starts at a younger age. I think that's the message. If you start at a younger age and die before the disease comes out, we don't remember it. But since we live 20 years longer, we see more of chronic disease. So this median age and lifespan, this extra 20 years, has made a big difference in what we see today. The second one is the modifiable risk factor. That means we can do something about it. And that's a major, major contributing factor. What we do in life affects the cell biology. And we'll come back in a minute to this. How did this all proceed? Now you heard somebody mention earlier diabetes, high blood pressure, this and that. That all comes as a result of genes. Well, I have blood pressure because my family had it. So it will be a question of genes. Genes, gender, age, ethnicity, lifestyle, oh, fat people develop diabetes and on and on. I'm talking about outcome of these is listed here. Diabetes, hypertension, high blood pressure, aging, many others. How do they affect the cell biology? That's where the blood vessel comes in. Most of the diseases that I just talked about are related to vascular disease. So the blood vessel is affected in the early stages. And what is that early stage? In the 20s, in the 30s. That's what happens. And then go a little later stage, which could be 30s, 40s, and then comes the disaster. We have heart attack. We have kidney problem. On that side, eyes and brain. And that's what we're going to talk about, the Alzheimer. If we are going to talk about at this stage, it's too late. If you want to prevent disease, then we start even before you develop diabetes, before you develop high blood pressure, and before you damage the blood vessel. So our emphasis should be more in prevention of that, and let it stay even at this stage, if not before it goes to the further stage. Because at this stage you cannot do anything. You cannot cure. There is no such a thing. You can control it, but you cannot cure it. You cannot prevent it. And that's the last slide. And that's what we should be starting. Child-oriented approach. The parents and the teachers, they have to come in. At a young age. Education, awareness, they should monitor. And then keep records and motivation. And we should not be talking about the end stage. We should be talking about vascular health. Can we see blood vessel? Yes. Look at the eye. Go to your eye doctor and see. They'll tell you what your blood vessel is like and what's happening inside. Or you take a sample of urine. And there are tests which we can do which will tell you what is happening at the blood vessel level. And more research is coming at that level, so we don't let it go beyond the vascular stage. I think that's what we should be talking about. So with this introduction, I'll ask Jamie to take over.
Okay, I'll just switch the presentations over. Okay, so thank you very much for the invitation to present again, Dr. Jindal and Mr. Lau, and for your ongoing support of the Alzheimer Society as well. And thank you for your attention today. My name is Jamie Constable, and I'm the First Link Outreach Coordinator with the Alzheimer Society, and I also work on our public education and on caregiver education. I've been with the society about a year and a half, and prior to that I lived in Prince Edward Island, and I worked for the society, the Alzheimer Society of Prince Edward Island, for 2 years. So I've been involved in this for about 3 years. Before that, I worked directly with families in the home, so I also have some experience working with the person with dementia and with caregivers in terms of what they face. So please don't hesitate to ask me questions today to clarify what I'm going to cover. The focus today is to understand the basics of the subtypes of dementia and then really to look at prevention. So who does it affect and how do we prevent dementia? And should dementia arrive, how do we treat it? What are the ways that we can look at treating it? So typically when I do presentations like this, I like to ask 3 questions. How many people are caring for someone who has Alzheimer's disease? How many people know somebody who is caring for someone with Alzheimer's disease? And how many people know somebody in this room? And I expect in a community like this that everybody would raise their hands, and so I won't ask you all to do that, because I think you know that everybody in this room is affected by dementia in some way or another, or has had a relative in the past, or will have one in the future. So that's one of the main reasons why this matters to us today. So I understand that, I understand what we're facing and have it in my family as well. And so I hope that some of this is of a help to you in your journey with your family too. So 15,000. 15,000 is the number of individuals who have dementia in the Ottawa and Renfrew County area, okay? I believe it's around 13,000 of that is just in the city of Ottawa alone. So even though we include Renfrew County, it's much smaller because it's a rural area.
Jamie.
You having trouble hearing me? I don't like microphones, so I'd rather not use one if I don't have to.
Okay, there's that one is active as well, if you
I
want.
can.
Wants to walk around.
I do.
Right.
I will try for those of you so you can hear me a little better. So if every person with dementia knew only 2 individuals, perhaps they had a husband or a wife, maybe they had 1 daughter, even with only 2 people, that's 45,000 people affected, just locally. However, we know that we have more family than just 2 people typically. And really, we're looking at 7 to 8 people in terms of a family, and then countless other health professionals. So the impact of this disease is very wide, even though it is perhaps the disease that is spoken about the least. In 2011, caregivers just in our area put in 8.91 million unpaid hours of caregiving, because the biggest percentage of the caregiving that is being done in the community, okay, not in long-term care, although people do spend several years there. But really, it's you and I who put in these unpaid caregiving hours, and it's a huge burden. So today, again, I want to look at the dementia subtypes, who is affected, early indicators, prevention, treatment, and care. I'm going to turn this so I don't have to keep looking. Okay, so what is dementia? I've had this question today, and I have it every time that I present, and there's always a lot of confusion around it. Dementia is just a term that describes a set of symptoms. Dementia is not itself the disease. It is describing a set of symptoms that includes loss of memory, understanding, and judgment. So changes in terms of cognitive function. But it is not a disease. There is a disease or a series of diseases that cause these symptoms. Some of those are reversible and some of those are not. And we're going to look at the difference between those today. So reversible causes of dementia. Typically, when you see a reversible cause of dementia, it has come on very suddenly. It has come on rapidly. You'll see a change in personality. The person will be very confused. They will be having huge lapses of memory. This is known as a delirium and not a dementia. Okay? And these causes of dementia are reversible. Depression, anxiety, and stress can cause changes in memory, understanding, and judgment, especially things like losing a loved one, a family breaking up or divorce, losing a job, maybe living through a disaster. Each of these things can actually cause symptoms that look very much like dementia. Thyroid disease and infections as well are physical causes of reversible dementia. And so if you're having symptoms of dementia, it's really important to rule out these other causes and not to assume right away that you have Alzheimer's disease or you have vascular dementia. you want to go to your doctor and get tested for these types of occurrences. So thyroid, you want to check your thyroid. That's a blood test, as Dr. Jindal has been speaking about. Infections in the elderly, especially things like urinary tract infections, can cause the symptoms that look very much like dementia. And these symptoms can be present for a long time because sometimes the infection isn't giving symptoms that are bad enough for the person to seek medical attention. So again, you want to rule out a bladder infection or a urinary tract infection or even another type of infection that might be present, which again, you can check out through a blood test. There could be drug interactions or side effects. To tell you a personal story about this, my grandmother had surgery 2 weeks ago, and she began acting very strangely after the surgery. My mother called me, and she was sure that my grandmother had gone crazy. She said, "It's coming out now. I've known it all my life. She's crazy. You should see what she was saying. She's been manic. She's asking all sorts of strange questions. She's behaving strangely." And what happened was there was an interaction between the pain meds that they had given her after surgery that had made her act very strangely for about a week and a half until they figured out it's a polypharmacy issue, interaction amongst medications. As well, vitamin B deficiency, B12, specifically deficiencies and hormone deficiencies can cause the symptoms of dementia. So again, another important number to get checked. So knowing your blood pressure, having your blood test done regularly is very important. So are there any questions about the reversible causes of dementia before I go on? Okay, so when we're looking at dementia as a disease, okay, you've heard the term Alzheimer's disease. Have you heard the term frontotemporal dementia? That's more rare. Vascular dementia, Lewy body, and mixed dementia. Okay, these are the most common forms. I'm going to talk about Alzheimer's disease in a minute, so I'll start with vascular. Vascular disease occurs through cardiovascular illness that builds up and affects the brain. This can happen through stroke or a series of mini infarcts. But essentially, especially with hypertension, you have changes in the brain due to changes in the blood vessels that cause damage to the brain that gets significantly worse over time. Okay? And it's irreversible once there is a vascular dementia process. Frontotemporal dementia typically has an earlier onset. You're looking at maybe between 40 and 65 years of age, and it's affecting the frontal lobe areas of the brain. So if you've ever heard about severe changes in personality or aggression or hallucinations and delusions that occur with dementia, frequently this, and it's happening in the early stage, frequently it's a frontotemporal dementia, and it's much more rare than Alzheimer's disease or vascular. Lewy body dementia is a type of dementia caused by the Lewy body protein building up inside the brain. There can be Parkinsonian-like tremors with this particular form of dementia, and there can be more hallucinations. Again, I believe it's probably third or fourth after Alzheimer's disease and vascular and mixed. Lewy body disease has a relationship with Parkinson's disease as well. If the Lewy body dementia starts first, Parkinsonian symptoms can result. But however, you can also see dementia in someone who has Parkinson's as the Parkinson's progresses, okay, because of that buildup of the Lewy body in the brain. Now, mixed dementia, which is actually potentially the most common pathology, is a combination of two different types of dementia, which is typically Alzheimer's disease and vascular. That's very often the combined pathology in a mixed dementia. And if they can't tease it apart in the diagnosis, because it is a very difficult disease to diagnose, they might say just dementia. They might say mixed. They may not be able to say which subtype it is. So what is Alzheimer's disease? We hear more about Alzheimer's because it is the most common. And it involves a buildup of specific proteins in the brain called amyloid or tau, which damage brain cells. They create a system of plaques, which is a buildup, and tangles between the neurons that destroy the brain cells, that reduce the brain's ability to send messages, that causes an atrophy of the brain, essentially. So you're using less and less of your brain as the neurons die off. From the time that we hit 40, we have a natural die-off of neurons in the brain. Okay, this is a natural part of aging. But with Alzheimer's disease, there's a rapid die-off. It is not a natural process. It is a disease process. This particular form of the illness is progressive, degenerative, and irreversible. Okay? There are medications that we'll discuss that treat symptoms, but they do not have a cure for this illness at this time. So what does dementia look like? The progression varies significantly from person to person. It depends a lot on the state of that individual's health, on what they've done in their life, on the cognitive reserve that they've built up through education and languages. It depends potentially on their support system and on their ability to be connected in their community. But essentially it ranges anywhere from 3 to 30 years with an average of 7 to 12. Okay, this is the disease process. The progression you will hear described frequently in terms of early, middle, and late stage, although there really isn't any clear mark in between each of the stages. And there are other divisions as well that are used from time to time. So what does it look like when you're living with dementia? It is a very difficult diagnosis to receive for most family members. And there are many reasons for this. There can be denial about what is happening. There can be stigma around the illness because although it is an illness of the brain, sometimes it is called a mental illness as well. And because of the mental illness stigma, people think that it's some sort of deficiency of the individual. But it is a disease process. It is not a fault of the individual. Neither is mental illness. But again, there's these living stereotypes that we have in our society. And because of that, dementia is one of the more difficult diagnoses to receive. Anosognosia is a bit of a fancy word that means loss of insight. That is one of the other reasons that the diagnosis of dementia is difficult to receive. Because frequently, the person is not getting diagnosed until they're already in the middle stages. Perhaps they were afraid to go. Perhaps they were hiding carefully their symptoms. For whatever reason, it could be that the doctor wasn't comfortable delivering the diagnosis. There are many reasons, but what we see is people are being diagnosed too late in the course of illness, and sometimes, and often, it is after insight is there. And so the diagnosis is not understood because the person doesn't realize they're forgetting. They don't realize that there's any change, and sometimes they're outraged at the suggestion that there's something wrong. There are complex effects on the spouse, the children, the grandchildren, friends, work, and legal and financial planning for the future. Everything changes with this disease. You have to develop personal strategies and family and community strategies in order to compensate, to maintain quality of life, to plan for the future, because all of this is possible. It is possible to continue to have a good life. It is possible to plan ahead and be prepared for what is coming. But again, early intervention is very important. Many of the common and quite normal emotions are anxiety, fear, grief, loss, isolation, withdrawing from family and friends, and existential or spiritual crisis. So who does it affect? Well, dementia affects about 1% of people ages 60 to 64, okay? And then when about 30 to 50% of people who are more than 85 years old. So as you can see, the number significantly jumps with age. With this illness, age is still the greatest predictor of developing. Once you hit age 65, your risk increases, it doubles, it increases 5%, it doubles every 5 years after age 65. So again, increased age, increased risk. Who does it affect? Some studies have suggested that women are more affected by dementia. But you have to be careful with some of these studies because there's other sometimes confounding factors. For instance, women as a group live longer than men, and so more women have dementia because there's more women who are elderly, okay? Genetic Alzheimer's. Some people say, my aunt had it, my mother had it, my grandmother had it, will I get it? Well, the genetic predisposition for Alzheimer's disease, it's only about 5% of the cases. That's where there's a gene, the APO allele. I'm sorry, I'm not a doctor. I don't know the official gene, but it's where you have the direct gene. It's only 5%. That's a very low number. And this onset is typically between the age of 35 and 60. So it's not the Alzheimer's disease that you're seeing in the elderly. It's happening very young, okay? There is also a link between Down syndrome and Alzheimer's disease. I don't know how prevalent it is in the population in India, but there's a relationship between Alzheimer's as well as Down syndrome and chromosome 21 changes. So there is a link there. There's evidence to suggest that a person who has received a severe blow to the head, especially in later life, is more at risk as well for developing Alzheimer's disease. So it's another good reason to wear your seatbelt, wear helmets when you're doing different kinds of sports or different things that are dangerous. There's also mounting evidence to suggest that people with a higher level of education are less at risk than those with a lower level. And again, this is something called, potentially called cognitive reserve, which means that you have more brain to lose, so to speak. You've created more connections, your brain has more neurons that are still functioning. And so potentially the disease process would happen slower, if at all. There is no known cause. It's a very frustrating thing to hear, that there's no known cause for this disease, but there are many risk factors that have been identified, such as cardiovascular disease, diabetes, obesity, family history, depression, smoking, and excessive alcohol use. Those are some of the top risk factors. So factors you cannot control. It's interesting, we didn't plan this, but we covered some of the same things in our presentations. In terms of dementia, when we talk about dementia, the things that you cannot control are age. We all get older. Unless you decide to check out earlier, we are all limited by the age process until we figure that out. I know, if you read back through history, we've been trying to figure out how to stop aging. We're not there yet, maybe someday. We cannot control the fact that we get older. We cannot control our family history. You can look at it in terms of, these are the cards I was dealt. You can look at it in terms of your karma. You can look at it in terms of genetics. Again, you can't control your genetics until we figure out how to do gene therapy. This is the hope for the future, okay? I'm hoping they figure out how to fix knees, because I have that problem. Factors you can control. There's many more of those, okay? And the interventions have to happen earlier in life. So alcohol use, atherosclerosis, which is again part of your cardiovascular health, blood pressure, stress, and cholesterol, depression, diabetes, smoking, obesity, and high estrogen levels. This is in particular looking at the estrogen supplementation that's happening in women after menopause. So I guess when you look at this list, you and our society as a whole have control over how these factors affect us outside of our genetic predispositions, okay? We can decide if we want to smoke, we can decide if we want to drink excessively, and we decide what we put into our bodies in terms of where we work and what we eat. Yes?
Should estrogen levels be high or low?
I believe lower. I believe there's too much estrogen being prescribed. So factors you can control. What we see here, we see a woman who is either a nurse or a doctor, and she looks like she's taking blood pressure. You must track your numbers as you age to know if you are on track or not. You can have changes in your health without having symptoms. And if you catch them early, you can reverse them. But at some point, it becomes quite difficult. The further you get into a disease process, the more difficult it is to reverse it. And there's not many treatments, especially not for dementia. You see in the middle, I put food in the middle because I'm a big believer that what we put into our bodies affects the health of our cells. It is our body that is breaking down these foods. And there are certain diets that are said to be more or less beneficial to our cardiovascular health. A Mediterranean diet in particular has been identified as one that is positive for our health. And that is a lot of vegetables, okay? A lot of raw, green vegetables and healthy oils, like olive oil, cold pressed olive oil, fish oils, and things like that. Now, I read a study, I looked up some information about India, because I'm assuming most of you come from there, and I wanted to see what I could find from the culture. And there was an interesting article about a city, or a village, I apologize, a village in the northern part of India that was very poor, but had almost no dementia. They ate a vegetarian lifestyle, they were a very close-knit community, there was a lot of joy, it was very easygoing. They had no stress and they had almost no disease because of the lifestyle in that particular community. I also looked up to see, because last year someone asked me about curcumin, which is present in curry. And I wish I had better news about a miracle cure, but they're still researching it, okay? There's 4 clinical trials that have happened. 2 have already happened and they had no significant results to report, and 2 are still ongoing as we speak, but it's very complex. Because even the curcumin that they're using is not naturally sourced, like by eating curry every day. It's an extract, and it's a potent extract that's coming out of curry that they're trying to see if it has an effect. And in rat models, in animal models, they are showing that there is some effect against the buildup of plaques. So again, there's nothing that I can report with sureness to say that this is evidence-based, eat lots of curry and you won't get Alzheimer's disease, but they're still looking at it, okay? There's some people doing yoga there. Along with food, exercise is probably either more or as important as food. Whatever exercise you do, it should engage the cardiovascular system as well as the strength system. But even walking is excellent for your health. Spirituality is also an important part of your life, and it's an important part of your mental and physical well-being. And the last one, you see a group of women together. When people gather together, it has an amazing effect at reducing stress and tension and improving our health. We need to stay socially connected to others. We're healthier that way. Okay. So, what is normal memory loss? Some degree of memory loss is normal. Having difficulty with a person's name, forgetting why you went into a room, walking all the way to the end of the office and forgetting why I'm there, walking back to the cubicle, that's quite normal. But if I was unaware that I was doing that, if I was embarrassed or frustrated when somebody pointed it out, that shows that I don't have insight into those changes, and that's a problem, okay? So we're going to look now at some of these. Who is this affecting? What are the early warning signs? What is not normal? Sorry. Right. Yeah, you're unaware that you're forgetting. You repeat questions and statements in the same day or in the same conversation, and you forget important details. So I expect that you're going to forget a great deal of what I've said today, because it's a lot of information. But if we had a short conversation personally, and you couldn't remember anything that was said, that is indicative of something that you may want to check your memory. Yes?
In looking at memory loss, is it useful to differentiate between short-term and long-term memory?
Yes. Yes, absolutely. With Alzheimer's disease and with other forms of dementia, typically the short-term memory is lost first. Yes. The long-term memory can stay almost right through to the end. Yep. Again, the memory loss has to be so significant that it's affecting your day-to-day ability to function. It is normal to forget an appointment and then remember it later. Oh, I forgot to go. I forgot to put it in my calendar. You know, it's normal to forget a friend's name. I forget names all the time. I'm terrible with names, and I'm in a really bad job for forgetting names, actually. But it's normal to do that, and some people are more forgetful than others with names. It's not normal to forget an appointment and not remember you ever made it, or to be unable to recall a former friend's name, okay, or a child's name, or your partner's name. Difficulty performing familiar tasks. Occasionally we make errors in a recipe, we make an error playing a game that we've played, but to be unable to prepare our favorite meal any longer, to be unable to comprehend or follow a frequently played game, you know, maybe you play complex card games. If you're suddenly unable to remember the rules, that might be a sign that there's something wrong in the brain. And again, you have to rule out the reversible causes dementia first. Problems with language. Sometimes you have trouble finding the right word, especially if you're trying to get fancy and find a really good word. But if you forget simple words, or if you don't know how to identify objects, like, can you move the thing that you sit on? The chair is what I'm looking for. But if you can't find that word, which I've seen happen, then you might want to have a look at your brain health as well. If you substitute words, you know, perhaps it's a garbled word, it's a word that doesn't make any sense, but that's sort of what your brain has processed at the time. Disorientation in time and space. It is normal to forget the day of the week, especially if you're on vacation. It's normal to make a wrong turn downtown with all the one-ways. It's very confusing, you know. It's not normal to forget the year that you're in. It's not normal to get lost on your own street and not know how to get home. That shows some pretty serious levels of confusion, okay? Impaired judgment. It's normal for us to procrastinate seeing the doctor or a dentist when we're experiencing a problem, okay? Life is busy, we forget. It's normal to forget to bring an extra jacket. When fall happens, you start having to plan a little differently. It's not normal to not recognize the need at all to see a doctor if you're unwell, okay? Or to wear heavy clothing on a hot day, which was an issue with a woman that I looked after. She would put sweaters on in weather like this. The problems with abstract thinking is another sign, a warning sign of dementia, okay? From time to time, you might have trouble balancing your checkbook or doing your taxes. You might not be able to find the best price because you're rushing. It's like, what? Oh, 30% off this and 40% off this. What's the difference if the prices are different? But if you no longer understand what numbers mean, if you're able to understand what does 50% mean, or what does 50% off mean? It means a good deal, I think. But what about misplacing things? Anybody lose their keys? Lose their wallet? Lose their bank card? Leave your jacket, you leave your wallet in your other jacket pocket and leave it at home and go all the way to work? Or your phone, your cell phone? My phone, I wish it had, a reminder to me. Oh, you're walking away, you're leaving me, because I forget it all the time. It's not normal to put your keys somewhere they don't belong, like the sugar bowl, unless you've done that all your life. It's not normal to put your wallet in the freezer, and if you find yourself doing that, and this is very common, it's laughable, I know, it's funny, you think, but these things begin to happen to people with dementia. Changes in mood and behavior. Sometimes this is one of the first things that people notice along with the memory loss, is the person becomes sad or moody from time to time, or they withdraw. That's the normal part, sad or moody from time to time, If we're facing things in our life that are causing us to be sad or moody, then that's a completely normal human response. But if the person changes very quickly, has rapid mood changes, becomes irrational, okay, if they're faced with a problem, these can be indicative as well. Sometimes you'll notice it more slowly. Slowly it's like, well, Mom doesn't seem to want to go out anymore. She used to play cards every Thursday, but she hasn't been out in months and she won't go. She won't come with me to the grocery store when I ask her to. Those kinds of things, that withdrawal, something to watch for. I believe that's here. So changes in personality. Subtle changes in personality may occur over time. We do change as we age. We become more mature, more wise, we hope. We maybe have different habits. But striking changes in personality, if a person acts completely out of character, this is something to watch for, okay? You have a kind father and suddenly he becomes a tyrant. Maybe there's something wrong. It might not be him, okay? It might be a disease process that's happening. And then a loss of initiative. This is the passiveness that I was identifying earlier. It's normal to tire of housework, business activities, social functions, but it's not normal to become very passive and apathetic in terms of life. Okay? You shouldn't need prompting in order to be engaged in your own life. Can I get a sense of time? I forgot my phone like I said I was going to do.
Another 3 minutes.
3 minutes. Let's go fast. Okay. So the diagnosis of dementia is a clinical diagnosis, and it involves observations and family reports, cognitive testing, and potentially neuroimaging if required. Not always. The cognitive testing is typically one of the things that's used to identify the level of functioning, although the family reports are very important to the diagnosis. We have no cure. We do have some treatments available. These are the 3 drugs that are used to treat mild to moderate. Okay, Aricept, Exelon, and Remenil are their brand names. They only work in 30 to 50% of people. They cause a lot of side effects for people, which is one of the problems with these treatments. And so, you have to talk with your doctor and maybe go on a trial to see how they work for you or for your family member. When Alzheimer's becomes more advanced, we look at the drugs Ebixa and Aricept to continue into the late stage. Each of these drugs does something a little bit differently, but again, I'm not going to go into that detail today. There are many non-pharmacological interventions for the treatment of dementia, for the family, as well as for the individual. And in fact, there can be more significant positive effects looking at the non-pharmacological interventions sometimes than looking at the pharmacological. These can make all the difference in terms of your quality of life. So if you look at counseling, different forms of counseling, psychotherapy, peer education, peer support and education, exercise programs, there's numerous studies that I've cited, some here, that show improvements along all of these different dimensions. And there's more than I have listed. I just picked out the top ones. Again, here are some other, and this presentation will be available as well for you afterwards, so you can refer to it, because some of the materials for reference, such as this, these are specifically different types of interventions that you can look at. There are many therapies for the person with dementia as well that you can look at once that person is in the disease process. Relaxation, distraction, reminiscence, all these types of therapies are available to keep the person with dementia engaged in a more normal life as they go through the process. So I want to close out by talking briefly about local programs and services, including the First Link program. The Alzheimer Society exists to alleviate the personal and social consequences of this disease. And how we do that primarily is by providing support on the ground for families who are affected, although we do also fund research. Most of the money that we get here goes towards supporting people in the community. The person with dementia, their primary caregiver, and the friends, family and friends. Okay? We do that through one-on-one support on the phone and in person, counseling, support, answering questions, problem solving. And then we have monthly support groups, comprehensive education covering from diagnosis through to end of life, and then helping you to understand the health system. How does it work? When do I access this service? How? Why? Okay? Support and follow-up, one-on-one support, referral to services, and an introduction to our other programs and services. We also follow up with you at 3, 6, and 12 months. We have over 20 support groups every month. So opportunities for you to gather with a group of individuals and talk about what your life is like living with Alzheimer's. And these are all specialized. Some are for wives, some are for husbands, some are for daughters. Some are for, the Coffee Clatch is really just an informal group. They gather over coffee, tea. Our First Link Learning Series, again, here's the list of the classes. So the first steps, that's for the person living with dementia and the caregiver. And then the rest are for the caregivers. So what do I do now? What is the planning that I need to put into place as I prepare? Planning for when care needs are increasing, when I have to move to retirement or long-term care potentially, if I want to stay at home, if my person with dementia would like to die in the home, how do I do that? I look at preparing for the move, and then care in the later stages. What are the changes that happen at end of life, and what are the decisions that we need to make then? This is 22 to 26 hours of education total that is done usually over a few years. There are many other supports in the community for families affected by dementia, including the Community Care Access Center, who provide services in the home, community support services, for-profit healthcare agencies. There are many of these companies. Private hire, sometimes your next door neighbor is a retired nurse who will come and help you if you maybe pay a little bit of money. Geriatric Psychiatry Community Services of Ottawa are very helpful if there's behavior issues. Okay, they can come in and do a whole behavioral support plan. If there's a lot of agitation or aggression or anxiety for the person with dementia, they can help to manage that. And then the Geriatric Assessment Outreach Team, if you want to have an assessment done in your home for cognition, for safety, for falls, that's who you would call. And then I have a few pages of references, but again, this will be available if you want to look up any of the studies afterwards. So thank you very much. I know I went over time a little bit today. I hope that the information was valuable to you, and I'm happy to take questions if there's time.
Any questions to Jamie? Please just remember, don't bring personal, long questions. Very brief question. We have only 10 minutes. And any question? Yes, sir.
Forget.
Pardon me?
Forgot. No, I got 3 questions, small one. And the first one is, if they are communicating something, do they understand it, but they can't talk about it? Is that a mental problem that they can't discuss back and forth?
So you're wondering if you speak with them, but they can't answer you, do they still understand? Is that your question?
Yes.
Yeah, what you're saying, she understand or he
Yes.
understand, but he stay quiet or smile or whatever.
Sometimes yes, it's sometimes difficult to know, but you can become more adept at watching body language and facial movements, because at certain points the person with the disease has a hard time vocalizing. They can't necessarily get what's working on in the brain through the language centers and out, but it doesn't mean that they don't still understand. And so you have to become good at watching the body language and the non-verbal communication. But yes, there was a woman that I worked with, to give you an example, there was a woman that I worked with who was non-verbal. I had never heard her speak. And I used to talk with her as though she could hear me and as though she could understand me. And sometimes I would have conversations where I would leave little pauses with her. And I told her, I said, my grandmother was a nurse and she worked during the war, and were you a nurse, Marjorie? And she turned around and said, no. Just like that. And I said, okay. And
Second
so
question.
still there.
Second question is, lifespan. Does it cause any early death or something like that?
Sorry?
Does it cause early death?
It can. It can. It is a fatal illness. It does cause atrophy of the brain, and the brain controls the other functions of the body. What we see frequently is that there's often other chronic disease processes happening at the same time. So there's almost always cardiovascular illness, or not always, but almost cardiovascular or diabetes or another illness that tends to take the person first. But dementia can worsen the progression of these diseases because of the atrophy in the brain and because of the poor management of the illness that the memory loss causes. Okay, so we see the dementia domino effect is what it's called.
Third question.
Any financial aid from government or somebody for nursing home or whatever to help out?
It's a very complex system, yes, and yes, there is financial aid. There's also many different forms of tax breaks and things like that. I would recommend coming to our legal and financial seminar in the fall, because we discuss powers of attorney and financial issues and preparing for planning in that session. The Community Care Access Center will answer all of your questions about long-term care and funding for that, because they are the gatekeepers there. So they can, and because that sort of changes, so you have to apply and see what you're eligible for. But yes, there is supplementary funding available.
Pandit, you have question?
Yes, I have a problem of losing my bunch of keys many times in a day.
I'm sorry.
But I have to track it all over the home. Then finally I get it.
Mm-hmm.
It happens too often. Every day, 2 or 3 times, I lose my bunch of
Survey?
On a more serious note, cardiovascular diseases and diabetes are very common in the Canadian community because of genetic factors and other things. Should all members of our community who are above a certain age and have been diagnosed for these conditions automatically look for dementia or for diagnosis? This may be overkill, but
I understand. I did read a little bit about other diseases in India to see if there was a cultural predisposition to dementia. There was nothing indicated in the literature that there was a cultural predisposition to dementia specifically. But yes, they were more. Those diseases were more prevalent in the. So again, you would think there would be more dementia. Screening, or the notion of screening, is sort of a contentious issue. Some people feel it should be done, some people don't. So I don't have a direct recommendation on screening. I think that if you are concerned about your memory, if you are concerned about the way that your mind has been functioning, then it's appropriate to ask for cognitive testing. I don't think everybody should be screened necessarily over a certain age, but I'm not a doctor, and I'm just listening to their discussions about it at this time. So I can't provide a recommendation really, but I would say that if you notice any of the warning signs that I discussed, if you noticed especially more than one, and if you notice that it's getting worse over time, that is your biggest clue that you want to get something checked out.
Yes.
Quick question, like forgetting names and numbers. Is it common of older age?
It is normal to forget names and phone numbers. Again, if it's something that you've always done, then that's quite normal. That's who you are. okay? If it's something that is happening worse and worse the older you get, and there are other things happening too, and it's getting worse over time, and it's impacting your day-to-day functioning, then I would look at getting cognitive testing done. But it is quite normal to be forgetful. In fact, more so now, because our cell phones remember numbers for us, right? We don't need to remember them anymore. So as culture changes, our habits like that change too.
Any other questions? Yes, please.
Brain exercises. Can you talk a little bit about that?
Sure. There are theories that the more active that we keep our brains, the more cognitive reserve that we build up, the healthier that our brains are, okay? So that can include everything from doing a Sudoku to playing a musical instrument, learning a new language, driving home a different way every day, using your left side instead of your right if you're right-handed. Whatever you're doing to increase the pathways in your brain or to exercise this muscle, and your brain is involved in your movement as well as your thinking, whatever you do can strengthen your brain. So doing those puzzles, doing those things is important to keep your abstract function higher. It doesn't necessarily mean that it will reverse dementia, although there are some therapies that are working with that now. But yes, very important to the brain health to keep your brain active. Okay?
Any other question? The purpose is introduction. You know, she mentioned about stigma. I think that's an important point, that we have to come up grips with it. We have to come forward. If somebody has it, leave the stigma temporarily out. There's a lot of help available. I left on the table all the printed information. Take it home, and if you need help, you want to talk to somebody, numbers are there. If you want to talk privately, please do so. And it's very helpful. We come up with and go and talk to somebody. If there is something can slow down the progression of the disease, it's so much better. And it's all there on that table. So please pick it up before you go. Anything else?
In response to what Dr. Shindal said, one of the worst things that you can do if you hear about a community member who has dementia is pull away from the family. One of the worst things you can do for them is not to be present. It might be difficult to know how to talk to somebody who starts to act very strangely, but you can learn about things to do. You can learn about ways to talk to them and to understand what's happening, to still be there for them. They might no longer be able to come out, but you can go visit them. And even if you think, well, they won't remember I was there, it does help them. The engagement will help them over time. So please don't let the stigma and the fear around the disease prevent you from learning how to be in a new way with people who have been your friends and family members for a long time. They need you.
Any other comments? Yes? Swapna, would you like to comment on anything more?
Excellent presentation, thank you.
Thank you.
Is there anything like breathing exercise?
Okay.
Breathing exercise can help?
Breathing exercise.
I would say that I haven't heard of any breathing exercises that help. However, I know that through the practice of yoga, there's different types of breathing that really, it boosts. Is there a yogic expert here? Because I know that it boosts the cardiovascular system, right? There are many. Are you all experts?
There are several people sitting here who teach yoga.
Okay, so I am not the expert in the room. In my limited experience, as I have practiced yoga, not every day, what I understand is that it can boost your cardiovascular health by breathing. You're taking in more oxygen. Now, can somebody else speak to that? Will somebody say a few words for me?
Dilip, you want to speak?
There's other people, I'm sure they'll.
Oh. Come forward. Briefly, please.
There are different yoga exercises which improve your cardiovascular system. The reason they do improve is because they improve your lung capacity. The improvement of the lung capacity results from the expansion of the chest cavity with the and the diaphragm pushing down. So when you do a deep breathing, or what is called Brasrika, or bellows, what you're doing is you're breathing, expanding the chest, pushing the diaphragm down, so you're increasing the chest cavity, inhaling as much oxygen as you can, and then you suddenly expel it. And when you do that, you're contracting, and when you do the reverse process, you breathe in. So this process improves the intake. Now, in breathing, if you do slow breathing, which is used for meditation, if you do a deep, slow breathing, you hold it for some time. That holding is called kumbhak. In that process, what happens is that it gives more opportunity for the oxygen to diffuse back into the bloodstream and carbon dioxide to come out. So that way it enriches your bloodstream. So that is a slow process of breathing. So those who have age and difficulty in breathing heavily, they can do very slow breathing. Hold it and slow down. So anything else you can talk to me later.
Make a 30-second comment.
Sorry.
I'm a strong believer in Sirshasan, but obviously you're not going to start at this age, because with Sirshasan, you're pumping blood straight to your brain and a lot of oxygen. And I'm sure that will help you prevent Alzheimer in later stages in life.
Thank you. I think we just conclude this session. I just want to mention prevention. When we talk about prevention of disease, when the disease is there already, there's no such a thing called prevention. That is called secondary prevention, means complications of that disease. If you want to start with the prevention program, it has to be at a young age. Prevention, all those recommendations help at every age. There's no doubt about it. Every age, 50, 60, 70, 80, the benefits will be similar. I mean, similar in the sense, according to what you put it in. It won't be that much as you start at a young age. Again and again in these seminars, we have stressed there are non-modifiable risk factors. We mentioned 4 of them. Think about it. The genes, the gender, ethnicity, and very important is the age. And those things which we can do something about it, which is the most important, is your lifestyle. And so with that recommendation, I like to conclude the session with my thanks to Jamie in the usual way. And the next seminar is on the second